Okay. Just a couple more seconds, inshallah, and then we can start. Okay, Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah, alhamdulillah, wa salatu wa salamu ala rasulillah wa ala alihi wa sahbihi wa man wala wa man tabi'ahum bi ihsanin ila yawm al-jazah ma ba'd. Alhamdulillah, alhamdulillah, alhamdulillah. It's a great blessing of Allah subhanahu wa ta'ala who has given us all the tawfiq, the good fortune and the ability to come together again, inshallah, for taking time out. May Allah accept this gathering. May Allah accept those who helped put it together, inshallah. May Allah accept all those who are participating. Ameen ya Rabbil Alameen. Our program this evening is being broadcast live on YouTube. Inshallah, I'll be sharing the link in the description. Please share it with the community members as well. If they are subscribed to our YouTube channel, they'll get the notification automatically. But either way, this program will be recorded, and inshallah, we will be publishing it after the event is over as well for everybody to access later on. But alhamdulillah, alhamdulillah, we are very blessed and honored to have one of our esteemed public servants in our community, representing our community, joining us this evening. It is on my great pleasure and honor on behalf of the Board of Trustees and the Executive Committee of the Islamic Center of South Jersey. My name is Niaz, and I am the Imam and Religious Director here at ICSJ. Inshallah, we make dua, may Allah inshallah accept all of us who are taking our time out to benefit from this program, as we welcome and as we take guidance from and learn from our esteemed guest, Dr. Shereef Elnehal, who is an American physician, alhamdulillah, who was the 21st commissioner of the New Jersey Department of Health. And in July 2019, he became the president and CEO of University Hospital in Newark, New Jersey. He was part of President Joe Biden's presidential transition team as of November 2020 to help out with efforts for the transition of the US Department of Veteran Affairs. And alhamdulillah, he is very, very active in our community. We are honored to have him share his experience and his knowledge and his guidance with us as we discuss this topic about the COVID-19 vaccinations. There are many, many different questions people have regarding it, as far as what do we make of it? Is it something that is okay for Muslims specifically, for specific members of the Muslim community? And also we want to take some time to benefit from his area of expertise in mental health. Perhaps we know about the tragic incident that took place in Dallas with a Bangladeshi Muslim family a couple days ago. Perhaps it has reached our news headlines. That is something that we need to think about, we need to talk about, we need to start any conversations that not have been started yet, and continue those conversations that have been started, and follow up after those conversations have started, inshallah, as far as resources and support for our community. And so we make dua, may Allah subhanahu wa ta'ala bless Dr. Shereef and his family, preserve them with afiyah. And without any further delay, I will, inshallah, welcome Dr. Shereef, inshallah. Please, bismillah, tafaddal.
Assalamu alaikum, and thank you, Mufti, and thank you to ICSJ, to Qasim and others who helped put this together. I am so pleased that our faith-based institutions in Islam here in New Jersey are talking about this issue. I think it's a very important one for our community, for our ummah, for our loved ones, family, and community. And it's really an honor to be able to address you about our experiences and efforts here in the city of Newark, but also just in general how I view this as not only a halal endeavor, but one that really all of us have the imperative to do, inshallah, in our community to get as many people vaccinated as possible for their safety and the safety of our community and really everybody who we live with, work with, and interact with in our communities. So thank you again, and really just a pleasure to do this session with all of you. I'll start with our experiences here at University Hospital, and I think they're reflective of so many experiences across the country, including South Jersey. I believe that South Jersey's surge of COVID-19 cases came a little bit later than Northern New Jersey and the New York metro area, but most people have some experience with this disease impacting someone close to them, if not themselves, because of just how wide it has spread in New Jersey and across the country. This is a disease that has impacted everybody's life in the entire world. If not because you've been infected by the virus or have had a loved one infected, but because of the very difficult decisions that our leaders had to make to alter our society and the way we live to prevent further spread of the disease. And I'll go into that in a little bit, but I want most of the conversation today, inshallah, to be about vaccination, which is the path, is the road out of this pandemic, period. There is nothing else that is going to get us out of this pandemic and get us back to, as we say, the new normal or the future of normal. The reason I use those terms is that life isn't going to be exactly the same. We're already seeing, for example, places of work do much more things virtually and make decisions on a permanent basis to do more things virtually. And so that in and of itself is something that will alter our lives. But regardless, I think we are nowhere near normal until we vaccinate at least 70 to 80% of the population. And I'll go into why in a minute. I want to just talk about first what we experienced here in Newark. And just to remind folks, different estimates have put the number of Muslims as a percentage of the city close to 20%. Vast majority of Muslims here are African American. We do have other demographic groups as well. As we know, our ummah is diverse, it is vibrant. In general, in New Jersey, we have every type of Muslim you can imagine here in this state. And we're one of the states that has the most Muslims per capita in the entire country. But this is a story here in Newark of this disease disproportionately impacting people of color. And that includes Black and Hispanic residents. I remember walking through my hospital, which has about 350 beds, where every single bed, essentially, other than our pediatric unit and our neonatal ICU, was filled with somebody who had this disease. It was a situation that I've never seen before, and most people in healthcare have never seen before, where you had folks mostly of older age, but people of all ages being admitted to the hospital and having up to, if they went to the ICU, a 60% mortality rate in the ICU when we first started this. So if you required a ventilator, normally in normal times, most people can get out of being ventilated. And the mortality rate for anyone ventilated is much lower than that. We're talking about a disease that if you required hospitalization and if you especially required critical care, had a greater than 50% chance of death. That was scary because we had many deaths every day. And it was to the point where we had to have frozen trucks outside of our hospital to be able to care for the deceased. This is something I've never, ever encountered in healthcare before. And of course, I could not help but notice as I was walking around with my leadership team, trying to support the front line here, trying to do everything from carry boxes of personal protective equipment to just having conversations of support as the leader of this hospital. I was doing town halls, virtual town halls, at least every week, if not more frequently. I was interacting with units of our hospital that unfortunately had a member of our staff die from the disease, and supporting them and getting them through it. And all the while I had to, in some way, at least fashion a story that there is a light at the end of the tunnel, that this pandemic would end. And I wasn't certain when it would end, but I know that pandemics do end based on history. Unfortunately, That timeline at that point looked like it was going to be years from last spring. Thank God and thank Allah that we are actually close to the finish line now of finally getting out of this pandemic. Just over a year after the pandemic started. If you look at history, when the last major pandemic was about a century ago with Spanish flu, you were talking about years of people getting infected with this severe version of the flu and everyone having to alter their lifestyles to accommodate it. This was in the late 1910s, early 1920s, when healthcare and our knowledge was so limited. But what wasn't limited in terms of knowledge that we actually had to apply now was the idea that you had to, in order to prevent a surge that our hospitals could not handle, and we were close, by the way, had Governor Murphy not called for the shutdown of businesses, non-essential businesses, and stay-at-home order, when he did, we would have had to ration healthcare in my hospital. We would have had to take the painful decision of deciding who would get a ventilator and who would not get a ventilator and be allowed to essentially suffer until death. That is what we were close to. And had that order not come a couple of days after it did, we would have had to do that. And we had every bed in this hospital filled. So you can imagine any leeway would have caused that situation to happen. So subhanAllah, that order came. They listened, even though it was a tough thing to do, and he's still getting criticism for that, despite the number of lives he saved, frankly. And I had a front row seat to that. Despite the number of deaths we saw last spring, I could not tell people, honestly, when I thought this pandemic would end. We all thought that it would end after the first surge. It didn't. It came back with a vengeance in the fall. It came back with a vengeance in the summer in states that did not carry the restrictions forward as long as possible. If you look at Texas, if you look at the Sun Belt, they have now 4 waves. We're in our 3rd wave in New Jersey. We avoided the summer wave entirely because we were careful about relaxing restrictions. And we took our time doing that as the science would have dictated. But we could have been in another surge over the summer last year. We have been in a surge again in terms of the 3rd wave since the fall, 2nd wave. And now we're in a 3rd wave with the rise of COVID-19 variants. But now I can honestly tell all of you that the light at the end of the tunnel is here and the finish line is within sight. If you take this vaccine, and we have 70 to 80% of the population taking this vaccine, we will get out of this pandemic and we will be able to not.
I was on this thing. Can you?
So that if everyone could go on mute, that would be great. Thank you. We won't have to wear these things anymore everywhere we go because of the vaccine and because of nothing else. So I will just keep reinforcing that throughout my talk because it is the ticket that we have to get us out of this. There's a lot of hesitancy to take this vaccine, and I know that that hesitancy is improving, and we're now much more talking about this concept of access and how we extend more access and as much access as possible to people who want it. But in the beginning, when this vaccine first came out, we only had about 40% of people in the city of Newark willing to take it. A lot of that is due to the very troubling history of systemic racism within the medical community. The fact that we had experimental gynecologic surgeries on women who were enslaved at the time of slavery in this country. The fact that we had the Tuskegee experiment, which was taking Black veterans who had served this country and lying to them, putting them into a science experiment that basically had them be observed for syphilis, even though there was a known treatment. And we have other examples. Henrietta Lacks was a woman out of Baltimore, and I trained at this institution, so I've heard this story many times. At Johns Hopkins, her cells were stolen from her without her knowledge, and so much research was done on her cell line, which still exists today. It's called HeLa cells that are used in science of all types, stolen without her knowledge, used without her knowledge, and without her consent. And those are just 3 examples of so many of how medical science has discriminated against the Black community. And finally, up until this day, There is the problem of implicit bias, which exists for all people of color, but in particular for Black Americans, whereby their symptoms and what they tell clinicians are not taken as seriously because of assumptions and latent biases that people bring to the table, even when they have good intentions and even when they're not aware of it. And we've had so many examples up to and including Beyonce and Serena Williams and their experiences with childbirth. These are famous people who, you would think are getting the most attentive, best care in the world, who also felt like they had complications that weren't dealt with in a timely manner because of their color of their skin. That is the extent to which we have implicit bias in this country. That also informed the way people were interpreting what this vaccine was and why, asking me and asking us why they should trust the medical establishment. That hesitancy has improved. So now we have well over 60% of the city of Newark willing to take this vaccine. In most community, that's now over 70%. And so it is a matter of getting vaccines to people while still working on, of course, the folks who are hesitant. But at this point, it's really about getting more supply and getting people connected to an opportunity to actually get the injection. And so I want to emphasize that that is the main focus now. There's a FEMA site in the city of Newark that opened that is now vaccinating 6,000 people per day. That is a huge number of people. It's going to be here for at least 6 weeks to make sure that folks get that second dose of the Pfizer shots that they're giving. And all of that is very important and helps to extend access. I want to go a little bit into the science and reasonable questions that people have about, for example, why the science was so fast and why we are expected to take a vaccine that came out a little less than a year after it was starting to be worked on after the start of the pandemic. It is true that these vaccines are essentially medical miracles. They are more effective than any known vaccine, period. We're talking about vaccines with 95, 96% effectiveness, and universally across all 3 vaccines that are available now, 100% effectiveness against hospitalization and death. This is not something I've ever heard of or seen before as a physician, and I can't tell you of any other public health expert or physician who can tell you the same, who wouldn't tell you the same thing. These are blockbuster vaccines that are safe and effective, extremely effective. But let's talk about the science. A lot of concerns that if folks aren't aware of how the science was done, they may assume about these vaccines that I think needs to be addressed. So first of all, there's a misconception that this science hopped and jumped quickly directly to humans, that there was not basic research or animal research testing the technology. None of that is true. So for the mRNA vaccines, which are in fact are the first vaccines using that technology to be approved for people, these vaccines have been studied in terms of their science for almost a decade. So we're talking about companies like Moderna, companies like Pfizer, who had been looking at this technology for a long time and done a lot of research indicating that it works and that it was likely very safe in humans. There were also preliminary studies in place already for the technology, not specifically for COVID, but the technology behind the vaccine more generally, tested in animals, in mammals, with safe results and highly effective results. So with the COVID-19 vaccines, there was a very reasonable assumption that it would be safe and effective in humans, and it turns out that was true. We're talking about 95% effectiveness from Moderna and Pfizer overall. With Johnson & Johnson, it's just under 70% effectiveness. But for folks who get COVID, even after they've gotten the vaccine, it is universally mild disease. 0% of people who've gotten Johnson & Johnson, which is a single-dose vaccine. Huge advantages to a single-dose vaccine, which are obvious. 0% needed to be even hospitalized, let alone died. So it is a life-saving vaccine, just as much as Pfizer and Moderna is, which is the most important thing that we care about. Why didn't the clinical trials take nearly as long as we saw, for example, with the polio vaccine, which took 4 years, and that was the second shortest period from the time of scientific development ultimately to FDA approval? Well, there are ways to expedite research that are legitimate and still give you a scientific answer, especially in the context of a national emergency. And I don't think anybody would argue that this pandemic has presented a national and international emergency. So what they did for trials that are usually just a few thousand people, they actually multiplied that number by 10 in terms of the enrollment. And we were one of the sites for a clinical trial right here in the city of Newark, where we tested the Moderna vaccine. But because we were one of 80 sites across the United States and many other sites across the world testing this vaccine, the same is true for Pfizer, same is true for Johnson & Johnson, we had on the order of 40 or 50,000 people in each one of these trials between the placebo and the experimental arm of the trial. Those are very large numbers that allow you to detect differences between the experimental arm and the placebo arm much faster. Placebo is a decoy. It is a fake vaccine that folks think they're getting the real thing. And the reason you have to do that in a clinical study is because of something called the placebo effect, where I can literally tell you as a human being, this shot will cure your allergies, or this shot will cure your whatever it is. Inject you with salt water, which doesn't do anything, and 30% of people will feel like they got better because of the power of the mind, frankly. It's actually a phenomenon that I think comes from Allah, really. But it's amazing how that works, because you do see clinical benefit, even if you give something that is clearly inert and not something that's actually active. So to control for that and really see if the vaccines work, you have to compare it against a placebo arm, people essentially getting saltwater injections that don't do anything, don't harm you, don't hurt you, don't help you. And so when they've done these clinical trials with that many more people, they've gotten to a scientific answer much faster, on the order of 3, 4, 5, 6 months, about whether the vaccines work or not. And the question to answer with these trials is the infection rate, proving that the infection rate is much lower in the vaccine arm versus the placebo arm. And that was done for all 3 of the vaccines that are currently available. Let's talk about safety. There's a difference between side effects, which are common with even over-the-counter medications, and adverse events, severe adverse events. If any of these vaccines cause something like a neurologic syndrome, or temporary paralysis, Bell's palsy was proven to cause Bell's palsy, caused a clotting disorder, something that would really cause a severe condition that would require you to be hospitalized, for example, then none of them would have been approved, because these trials have the very rigorous standard that if you had to deal with one of these types of severe adverse events that ended up requiring something like hospitalization, the trial would have been stopped and we wouldn't have proceeded to FDA conditional approval, emergency use authorization. But that did not happen. There was no association between any severe adverse event with the vaccine, except for a severe allergic reaction. About 1 in 100,000 people get a severe allergic reaction with one of these vaccines. That is called anaphylaxis, when you feel like your throat is closing up and you can't breathe, and that is an emergency. But guess what? There is a very effective treatment for that emergency, and it's called epinephrine. So epinephrine injections done immediately after someone is experiencing those symptoms will cure you within minutes. For every person who gets a vaccine, they are observed for 15 minutes to ensure that they do not have a severe allergic reaction. So you get the shot, and most of your time at the vaccination centers, wherever you go, is in that observation period. And we have people and equipment with epinephrine injections right there for you in case you need it. We haven't had to do that for a single person so far at University Hospital. We've vaccinated tens of thousands of people in my hospital. So you can imagine how safe these vaccines are. No severe adverse events except for that, and it's highly treatable and it's extremely rare. Let's talk about side effects. The side effects can be significant. They last for a couple of days. They include pain at the injection site, fatigue, muscle aches and pains, nausea. But the good thing is that these side effects are fleeting. They only last for a couple of days at most, and they're usually not severe. And for people who have gotten the vaccines, they know that their second dose does feel worse than your first dose. So you may have to take more naps, for example, if you have fatigue. You may have to, maybe miss a day at work because you have a low-grade fever. That's okay, because usually within at least a day or two, you are okay and you're able to get right back to normal. Compare that to the risk of getting COVID-19, which can cause hospitalization and death. There's no comparison of the risk in my view. The vaccines are safe, effective, and much better in terms of what they do to you than having COVID-19. The other element of COVID-19 to remember is that it can cause something called long hauler syndrome, where you have a condition that lasts not a couple weeks, like most people experience with COVID, at most a couple weeks. You can actually cause something that lasts for months and months. In fact, for folks who are hospitalized in China at the very beginning of this pandemic, there was a study that came out just a couple of months ago that showed that 75% of people who had to be hospitalized for COVID had at least one symptom that lingered for 6 months or longer. Persistent shortness of breath, not being able to climb stairs without getting winded, a clotting disorder, stroke even in rare cases, but that has happened because of long hauler syndrome. And we're talking about stroke not only in older people, but in younger people who've gotten COVID-19, people in their 30s and even 20s in some cases, and there are case reports about this. COVID-19 is not something you want to get. Why take the chance if you have something that can prevent it and be 100% effective at preventing hospitalization and death? And there are no documented cases, by the way, of COVID long hauler syndrome, at least yet, for folks who have taken the vaccine. Of course, we have to figure out what the long-term data on that shows, but so far, so good. So if it prevents long hauler syndrome, as it very likely does, and it certainly prevents hospitalization and death, I think the argument is clear that inshallah, you should take this vaccine. The question that I get a lot, and I'll end here because I want to have some time for questions. We're about halfway through at this point, is, okay, well, Shereef, what about long-term data? Because we don't know if something could pop up years down the road. By definition, this thing was approved about after less than a year of these studies being done. That is true. We don't know if there are severe adverse events that may happen 4, 5, 6 years down the road. However, if you look at the history of vaccines, you would understand that it is extremely rare to get any effect from a vaccine years down the road. There was a controversy around childhood vaccination and whether it caused autism or not. That was published by the scientist in the UK, who subsequently had to have that study retracted from the British Medical Journal because they found that the data was falsified, and he was revoked in terms of his medical privileges and appointment at the university. So his career was over because he falsified data and information to try to create an association between autism and childhood vaccination. So I just want folks to be aware that there is no association that is scientifically supported between any type of vaccine and autism. There are also only extremely rare examples of anything related to vaccination that happens years down the road. So, and really nothing in terms of vaccinating against respiratory diseases like the flu. So I believe in the technology. I believe these are safe vaccines, and I do not believe there will be significant long-term effects. Want to dispel some myths as a last piece of this. It does not cause infertility. There's rumors in our community that it causes infertility. It does not. The Moderna and Pfizer vaccines were developed without using embryonic stem cells. So there is no use of human stem cells for those two vaccines. The Johnson & Johnson process briefly included embryonic stem cells, but not for Moderna and Pfizer. There is not any conspiracy with these vaccines regarding control or nanotechnology or microchips. I have to say it because there's a lot of ridiculous things on social media. But remember what we try to reinforce in our faith, which is deference and respect for expertise. There are references to that in the Quran. There are references to that in Hadith. And if you see something written by someone on Facebook who has no medical training or has, is suspicious in terms of their activism and other beliefs, chances are it's not right. Please consult the experts in our community. Please consult your physicians, your folks that in your community who have gotten the education to be able to answer these questions. Not everybody does have that education, but in those cases, and subhanAllah, we have a very well-educated community and a community that is disproportionately represented in the healthcare field. Please consult them with your questions and don't get it from a tweet or whatever posts are coming through social media. That is not the source for definitive information. With that, I'll end. I could go on, but I do want to make sure I have time for questions. Thank you. So how do you guys want to moderate questions?
All right. Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah khair. May Allah reward you. We have some questions being submitted in the Zoom chat. I can read them if you'd like, or you may read them and address them, inshallah.
Please read them. Yeah, that'd be great. Thank you.
Okay. What are the steps a pregnant woman should take if she had COVID during the pregnancy and recovered while isolating at home?
Okay. Very good question. And it's very important, first of all, to mention to please follow the guidance of your OBGYN or the physician or midwife or nurse practitioner who's caring for you. That is the most important thing to do because they know you, they know your specific situation. They know, for example, if you've had allergies to vaccines before. So one reason not to take the vaccine is if you've had anaphylaxis from a vaccine before, right? We don't want you to have that again. So we say, hold off. So that's the first thing to mention. Alhamdulillah, this vaccine has been used in many, many pregnant women, and it works, and it's safe in pregnant women from what we know so far. If you've gotten the disease while you're pregnant, as far as I know, it is the same guidance on the time that you have to wait before you get the vaccine after you recover. So to leave some room, the general advice is to wait 10 days after your last symptom or 10 days after your positive test, whichever comes later. Okay, so you can get the test, you have symptoms 3 days later. Okay, so it's 10 days from that point, not from the positive test. Once you've recovered from that 10-day period, you then wait at least 2 weeks, I would recommend a month, to make sure that your own immune system's reactions to the virus aren't interfering with your immune system's further reaction to the vaccine. And you may ask, hey, why do I have to take the vaccine if I've gotten the disease? And that's because we don't know how long immunity from having had the disease lasts yet. We don't have enough data to understand that. And in fact, there's some evidence that for people, especially who are asymptomatic, in other words, did not have any symptoms, may not have immunity that lasts after 3 months. These vaccines certainly get the job done, and you'll feel it with the side effects. By the way, the side effects are a sign that your immune system is flaring up and responding and learning what this virus looks like, which is exactly what you want to see. The whole reason we feel sick when we get diseases like the flu and like COVID-19 is that it's our immune system actually that makes us feel fatigued and congested and cough. All of that mostly happens from your immune system responding and trying to fight the virus, okay? So what your immune system is doing after you get the vaccine is actually learning how to fight the virus, which is what you want to see.
Quick response and I guess follow-up. You did touch on it in your answer just now. Question from the chat. When a person has been exposed to the virus and has developed immunity, then why does that person need the vaccine? Historically, we have seen that any immunity that has been developed is never lost.
So it's a good question. Unfortunately, it's not true that immunity that develops is never lost. So we see this, for example, for everything from mild diseases to more severe diseases. And that's why, for example, for certain things, we have to test for what we call antibody titers. So even if you were immunized as a child, for example, against pertussis or a different type of disease, oftentimes before you enter a new job or before your kid goes into school or whatever it is, you have to check to make sure you still have antibodies. And if you don't, you have to get what's called a booster, which is another round of your immune system learning, another vaccine shot where your immune system can learn again what it looks like. So it's not true that immunity that you develop lasts forever. Antibodies wax and wane variably in different people for reasons we don't understand. And for that reason, it is not true that folks who get COVID-19 necessarily develop permanent immunity. In fact, it may be the case that we have to take these COVID-19 vaccines more than once. So for example, we take the flu vaccine every year because the flu mutates every year. And it has a different genetic composition for interesting reasons. So we have to actually design a new flu vaccine every year and predict what it's going to look like so that we don't get the flu. For this disease, we don't know how long immunity is going to last. And so we may have to take it every year, every 5 years, or hopefully once in a lifetime, but we don't know yet. And so that's why, just to round it out, that we still want you to take the vaccine, even if you've gotten it, because we have a much better way of understanding how long immunity lasts after you've gotten the vaccine. The trials that prove that they were effective are going to go on for years. And we're going to learn things like how long antibodies last and how often we need to take the vaccine in the years to come.
Can I go with my question now?
Sister Saima.
Assalamu alaikum, Dr. Shereef, how are you? Can you hear me?
Yes, perfectly.
Yes, okay. So my question to you is, wonderfully you explained that how people are afraid because they had experiences with the Tuskegee Airmen and all those other things that were done, research was done on people without their prior knowledge. So in this day and age, we still have that fears lingering on in our people of color, in the communities, of color. And my personal experience as a healthcare provider is definitely it's an uphill battle when we are doing this in the community at large. In our own community, a lot of our African American brothers and sisters are saying that they are not going to get it. They're not going to get it. So when I ask them, and some of them are on places where they are, they're imams of the mosques, okay? And there's a lot of respect that goes with that position and a lot of following. So people who have so much following, if they are of this notion that this is something that's dangerous and people, probably the government is doing something to them without their knowledge, it's not really good. So tell us how we can help these people and prevent them from going that direction, especially our Muslim brothers and sisters. Or what would be an easy way to reach out to them, clinically speaking? As a clinician, how can I reach out to them?
Thank you. Are you a physician?
I'm a PA.
Great. So you obviously have experience treating patients and addressing their needs, and I've heard some of the same narratives I heard.
True.
And I want to, applaud you for that. You've taken care of folks who, in some cases, I'm sure maybe have had the disease or acutely or have dealt with it. And,
Yes.
mashallah to your contributions there, and thank you for that. One thing I'll say is, yes, these narratives are still ringing true with people. But one thing that is helpful for folks to understand is that, number one, these studies have been done with modern clinical research standards that didn't exist before in terms of institutional review boards and ethics requirements. So for example, every study has to go through not only a national for the NIH funded studies, but a local, what's called an institutional review board, looking at every aspect of the way the study is designed, including the consent forms, including the protocol, including how we communicate about the trial, whether people can be paid or not in the trial, which could be a form of coercion. All of those things are reviewed by a multidisciplinary group, and there has to be consensus that it is ethical. So that's one hurdle. Another hurdle, or another fact, I should say, is that for these trials, we actually had way more Caucasian and white people enrolling in them than we had people of color. So the ratio was over 60% of people were white Americans, a little under 40% were Black and Hispanic Americans, and otherwise people of color, that whole bucket, which does look like the country. 40% of the country is a person of color in some way. So that's actually way better than what we normally see. So normally in clinical trials, we see less than 5% enrollment by people of color. And that's because of the very narratives that you brought up, Sister Saima. So, they did a reasonably good job in getting hospitals like ours to participate. But the notion that it's targeting people of color just isn't true because it's obvious that a lot of white Americans were also in the trials. The third fact is that even in the interpretation of the data, it's done in a way that actually does not even allow for the company to mess with the outcome. The way it works is that the data is reported directly from local scientists who don't have stock in these pharmaceutical companies. In fact, they can't as part of their signing on to be a principal investigator. There's no conflict of interest. So our principal investigator here at University Hospital was someone known to the community, an infectious disease physician, well-respected, Dr. Shobha Swaminathan. She was the principal investigator here for the Moderna trial. She then submits data on infection rates, side effects, and outcomes, not to the company, but to something called a data safety monitoring board, which actually is run out of the NIH. So the NIH commissions these data safety monitoring boards completely independent of the company, and they do their own analysis. Then they report that analysis back to the company executives and say, your vaccine worked or it didn't work, or it had these side effects or it didn't have these side effects. And so there are so many safeguards built into the science behind these vaccines that really make it very, very unlikely that anyone's manipulating anything. And they've gone through such a rigorous ethical process for evaluation that hopefully these points will be helpful to people after they are clarified.
Thank you so much. I appreciate that.
If I may combine two questions into one, they're similar. How long is the vaccine good for? Do you need another booster shot in 6 months? And combining that with, since the virus is changing and developing itself, new strands and strains and threads, what will happen in 6 months? So if it's possible to combine these two questions and give answer to both. Jazakallah khair.
Yeah, it's a good question. I'll just say again that we don't know yet how often we're going to have to take this vaccine because we don't know how long immunity lasts. And those clinical trials, again, governed by the data safety monitoring boards, will tell you how long the immunity lasts. And when we figure that out, whether it's a year, 2 years, 5 years, the studies will determine the answer. The science will determine the answer. The second piece of it is, what about the mutations and the variants? The variants are a big deal, and the variants are a reason why we're seeing cases rise again in New Jersey, in particular, the UK variant, which quickly overwhelmed the UK before the vaccines were actually available. We would have seen another surge in our hospital and across the state and across the world, frankly, had it not been for these vaccines, because we vaccinated preferentially older people and people with more vulnerable conditions who no longer got the disease and had to be hospitalized. And so because of that, we're actually seeing younger people needing admission, which we didn't see before. Shows you how much more severe the UK variant can be. But every time anyone gets infected with the virus, there's a chance that the virus can mutate because the virus replicates millions and millions of times in every person it infects. And so because it does that, and the replication machinery that the virus is using in your body isn't perfect, sometimes it can mutate the viruses. And most of the time, if it mutates, it actually makes the virus inviable, basically kills the virus. But sometimes, and very rarely, but certainly at a certain percentage rate, it gives the virus a mutation that makes it more transmissible, more severe, or both. And the UK variant is both. So to prevent mutations and to prevent variants, you have to stop the spread, either through vaccination or through restrictions. So the more we vaccinate and the more we're careful until we get vaccinated, the lower the chance that one of these variants will arise.
A question about the children. How soon, when will they be able to receive any of the vaccines with regards to distribution? Any rough estimate at all, anything?
Inshallah, within a year, we will know how effective these vaccines are in children. So Pfizer, for example, released study results for children aged 12 to 15. They had already proven effectiveness in kids aged 16 to 18. But now we know, at least from their press release, that they believe it's effective for above age 12. That still needs to be reviewed by the FDA. But they're also doing a study for even younger populations, school-age children, starting from the age of kindergarten. So once we know the results of those studies, they will be released, and the FDA will be making a determination about whether to allow younger people to take it. I know for a fact that it's a public health goal to vaccinate kids. And the reason is that we're still seeing spread of the virus among kids. It's, alhamdulillah, not nearly as severe. Most kids are asymptomatic or have a very mild fever, but they can spread it. And so we don't want just for kids to be spreading it to vulnerable people, to grandma, grandpa, and to older relatives. And there's a very rare rate of severe Kawasaki's disease and some complications that can happen in children, but those are very, very rare. Nonetheless, it is a goal to, inshallah, be able to eventually vaccinate children. But the studies have to show that it's safe and effective first.
So yeah, we do know of the vaccines that are available, Pfizer and Moderna. Based off of your research, are the Pfizer and Moderna vaccines better, more effective than JJ and AstraZeneca, based off of the statistics and the numbers we have so far?
Good question. I would again emphasize that all three vaccines are 100% effective at preventing hospitalization and death, which is the most important thing. And which is why I tell people, please get whatever is available to you first. That is what will protect you. It's more important to get the vaccine fast than to get the vaccine you prefer. Because if you have to wait, you're going to be sent to the back of the line if you've already signed up, and you'll still have a chance of getting COVID, which is a bad situation, much worse than getting the vaccine. So please just get the first one available to you. In terms of the effectiveness, Pfizer and Moderna are essentially the same. Johnson & Johnson is just under 70% overall effective. But what that means is that there's a 30% chance that you could still get mild COVID, which means maybe a few days of symptoms, fever that requires you to stay home, but does not cause the need for hospitalization and does not cause, inshallah, long hauler syndrome. So I do think the Johnson & Johnson vaccine is worth it. And if it's available to you, please take it.
How soon can we start traveling again overseas after the second dose?
Yeah, that's a good question. The CDC released guidelines that if you are vaccinated, it is safe to travel and you do not have to test before you leave and before you come home. This is domestic travel. International travel is still not recommended because you are going to places outside of the country, which may have, certainly not nearly as vaccinated as the United States. The United States is one of the most efficient vaccination countries in the world under the Biden administration. They've done an extremely good job with vaccination. And so you're going to a largely unvaccinated population wherever you go, and you don't know what variants and mutations they have, and you're bringing that back to the United States. So until we really get 70 to 80% of this country vaccinated, but also please pay attention to the rates of vaccination wherever you're going, because all of that pertains to risk.
A very important question. I know that there are some hands raised. We will try our best to get everybody's question asked, but how can we set up in home or at our local masjid vaccination clinics opportunities for the Muslim community throughout New Jersey, specifically South Jersey, this community. We have family members observing the hijab. We have families who need help with transportation and language barriers, whatever it may be. If it is being offered for the community at a religious facility, more people will trust it and be inclined towards it. Any best practices or any recommendations in that regard?
Yes, there are ways to try and do that. So you can either partner with a local health system that is delivering the vaccine, or with a county site to have a pop-up clinic, pop-up event in a masjid. That's happened before in New Jersey, and it should be happening more. We've been doing churches here in the city of Newark, and if a masjid approached us and saying they were willing to do it, we would absolutely do it. But the city of Newark is doing that. Most of the county and city operations, if they exist, are ready and willing to work with you. So please do reach out to your local elected officials on this question. They'll best be able to direct you to your public health department. Also call up your local health department directly at the county level, and they can give you information about that. But there are opportunities to do it, especially when the supply increases significantly over the next few weeks. That will become a more easy option. And thank you for asking about it.
Sister Fatmata, you may ask your question, inshallah. Please go
Imam,
ahead.
Assalamu alaikum wa barakatuh. One of my questions was answered, but my second question, I'm sorry, I didn't get the whole presentation. But the question I have is about the Pfizer vaccine versus the Moderna vaccine, or the other one. So if you have one of the vaccines available for the first dose, and then that Pfizer vaccine is not available for the second dose, is it recommended, or is it okay to take either the Moderna one?
Very good question. So any site that gives you one of the 2-dose vaccines is either directly storing or has assurances that they're going to get the same vaccine again for your second dose. So any shipment of vaccines comes with a guarantee, and that guarantee has been reliable for us 100% for both Pfizer and Moderna as a vaccinating entity. You will get the same vaccine the second time. So it is very, very important for you to take the same vaccine a second time, because that's what was done in the clinical trials and proven to be effective.
And Brother Farouk, you may ask your question, inshallah.
Yes, Assalamu alaikum.
Wa alaikum salam.
Alaikum assalam.
Yeah, brother, my question is, I got the Moderna vaccine, and I'm wondering the variant is going to protecting that Moderna. Like I saw the news the last week, Pfizer is going to be covered, the variant one. And how about the Moderna? Do you know that?
Yes. So both Moderna and Pfizer have preliminary studies that show that their vaccines are effective against the most common variants, the UK variant and the South Africa variant, and I believe the Brazilian variant is being studied. But the UK variant is the one to be most worried about. And alhamdulillah, those first 2 vaccines seem to be effective. They're overall a little bit lower effectiveness, but that's okay, because as long as you're in the range of, in the high 60s with a vaccine, it's effective. Remember that, and I didn't mention this earlier, the flu vaccine, you're lucky if it's 65% effective on any given year. So these are blockbuster vaccines, and alhamdulillah, they seem to be working against the known variants.
Jazakallah, we just have under a minute, Sister Mona. You may have at least 30 seconds, inshallah, to ask your question if we can finish before 7 p.m. Jazakallah khair. Go ahead.
Okay, I have a quick one. Assalamu alaikum, Dr. Shereef, and thank you so much for so much information regarding the vaccination. I just have a quick question regarding how latest can we get the Pfizer or Moderna vaccine, the second dose?
Good question. So you really want to try as much as possible to take it at the exact interval that was done in the studies. So 21 days separated between the two doses for Pfizer, 28 days separated for Moderna. However, you can really wait for both of those vaccines up to 60 days if you need to. So for example, if you become ill with something else and you have to be hospitalized and it's not advisable to give you a vaccine if you're ill, you can wait up till that point to get it. The other thing to be thankful for is that the CDC published a report that showed that even with only one dose for the Moderna or Pfizer vaccine, you're up to a little under 80% protected. So it's a really good vaccine, even with one dose. But we don't know about other details, which is why we're really very much still emphasizing that people get their second dose.
Jazakallah khair. We are at time. May Allah subhanahu wa ta'ala reward you, Dr. Shereef, for joining us this evening. Special shout out to my big brother, our Amir here, brother Qasim. May Allah subhanahu wa ta'ala reward him for helping put this program together. May Allah subhanahu wa ta'ala accept and reward all of the brothers and sisters for joining and for coming. Again, if anybody has any follow-up questions, please feel free to inshallah, reach out to myself, reach out to the masjid. We make dua, may Allah subhanahu wa ta'ala protect us all, and all good is from Allah subhanahu wa ta'ala. Brother Qasim, if I may request you just, if there's anything you'd like to say on behalf of the community and the masjid,
I just
inshallah.
wanted to thank Dr. Shereef for giving his time. I greatly appreciate it. Very informative talk. And inshallah, we will invite him again. So this is not the last time. Inshallah, we will benefit from his knowledge. And again, thank you so much, Dr. Shereef, for coming on behalf of ICSJ. Thank you.
Jazakumullah khairan. We make dua, may Allah subhanahu wa ta'ala accept. Allahumma salli ala Muhammad wa ala ali Muhammad kama sallaita ala Ibrahim wa ala ali Ibrahim innaka Hamidum Majid. Allahumma barik ala Muhammad wa ala ali Muhammad kama barakta ala Ibrahim wa ala ali Ibrahim innaka Hamidum Majid. Allahumma lakal hamdu kama anta ahluhu. Allahumma lakal shukru kama anta ahluhu. Innaka ahlut taqwa wa ahlul maghfirah. Allahumma shfi mardana wa mardal muslimin. Allahumma shfi mardana wa mardal muslimin. Allahumma shfi mardana wa mardal muslimin. Wa sallallahu ta'ala ala khayri khalqihi Muhammad wa ala alihi wa sahbihi ajma'in. Subhana rabbika rabbil izzati amma yasifun. Wa salamun ala al-mursalin. Alhamdulillahi Rabbil Alameen. Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum, and thank you again for everything and for hosting this event. Jazakallah khair. Bye-bye.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Very nice information.